placement of the pterygoid implants. So these pterygoid implants usually we place it in the small cases to get the good proper anchorage from the posterior maxilla. That is, these pterygoid implants are placed from the second molar area in the maxillary arch till the area beyond the tuberosity of the maxilla. We have to evaluate the anatomical structures of this region, mainly the burrows, between the posterior maxilla and the lateral pterygoid head, lateral pterygoid plate. So this is the pterygopalatine fossa. So this pterygopalatine fossa is the area where we are going to engage our pterygoid implants. This pterygopalatine fossa is between the medial and the lateral pterygoid. So this is the area where we are going to engage our pterygoid implants. So let us discuss in detail about the importance of a maxillary artery in this region. So maxillary artery is a branch of external carotid artery. So this maxillary artery usually it runs laterally and it gives three branches. That is, the first branch will supply the auricle and also other surrounding structures, and the second branch it's called as the muscular branch, which supplies the muscles, buccinator muscle, and then temporalis muscle, and other few muscles it will supplies. And the third branch, which is the most important branch, which supplies and enters the pterygopalatine fossa through pterygopalatine fissure. So it enters the pterygopalatine fossa through the pterygopalatine fissure, and it gives the branches. Usually it gives 6 branches. The one branch is the branch to the pharynx, and the second branch is through the the pterygoid canal to the pharynx again, and the third branch is infraorbital. Coming to the anatomy of the pterygoid area, that is where we are going to place the pterygoid implants. Usually the area beyond the tuberosity of the maxilla, so that area usually we consider it as a good area to place the pterygoid implants. Usually beyond the pterygoid region. Importance of the maxillary artery, which gives many branches. The maxillary artery is a branch of external carotid artery. So external carotid artery usually runs lateral, that is behind the mandible. It gives 3 branches. The first branches to the ear and other parts, and the second branches to the muscles like buccinator and then temporalis, all those things, and the third branch is the main branch, which enters the pterygomaxillary fossa or the pterygopalatine fossa through the pterygopalatine fissure, which gives the 6 branches. So among the 6 branches, the main important branch is the pharyngeal branch and the infraorbital branch and the branches to the posterior maxilla. So here the most important thing is the branch to the pharynx. Okay, so it gives one branch to the pharynx and also another branch to the pharynx itself through the pterygopalatine canal. So if there is a damage to this branch, this is the pharyngeal branch of the maxillary artery, there will be profuse bleeding for the patients, and the patient has to be taken care of. And while placing the pterygoid implants, it is very we have to take utmost care that we are not supposed to damage the maxillary artery. Usually the position of the pharyngeal branch of the maxillary artery will be about 40 mm from the tuberosity. Above the tuberosity level, it will be about 40 mm, means 4 centimeters. Usually we won't place that length of pterygoid implant. So usually we place around a maximum of 29 mm or 30 mm. So usually we won't damage the maxillary artery, but we have to be careful while placing the lengthier implants here. Okay, there is a maxillary artery, the branch of the third part of the maxillary artery, which is the pharyngeal artery, we are not supposed to damage at all. So patient will have many complications if you are going to damage the pharyngeal branch. So we have to deal with this maxillary artery while placing the implant in the pterygoid area. So this is the main anatomical importance while placing the pterygoid implants, that is to take care of the maxillary artery. Coming to pterygopalatine fossa. where we are going to engage the pterygoid implants. Pterygopaltine fossa is the area between the posterior maxilla and the lateral wall of the pterygoid. So usually there is it's called as the fissure. The fissure will give into the pterygopaltine fossa. This is the fossa area where we are going to engage our implants. If we are going to engage our implants into this pterygomaxillary or pterygopaltine fossa, implants will have greater stability and courage and good torque also. So usually this is the D2 or D1 kind of bone. If you are not going to engage into this fissure, if you are going to engage only in the tuberosity area, that is in the posterior wall of the maxillary sinus, the bone will be usually D3 kind of. The engagement will not be good. So please engage your implant into the pterygopaltine fossa. Okay, so you can engage there, you will get good stability. So these are all the anatomical increments in the bony structures of importance, taking into consideration the position of the maxillary artery. So angulation is very important while placing the pterygoid implant. So you can start from the distal root of the second molar, angles 15 to 20 degrees towards the medial pterygoid. Don't ever place right into the lateral pterygoid. So exactly above the lateral pterygoid is your maxillary artery. So angulate towards the medial pterygoids. That is the area between the maxillary, the lateral pterygoid and the medial pterygoid. That is the pterygopaltine fossa area. You engage here, you will get good stability. Thank you.